Hello and welcome. I am Chris Wirch, an associate partner at JB&B, and we are proud sponsors of the Builds Bio Plus. Our firm is a founding member and I co-chair the Life Science Committee. I am honored to be a part of this organization and thrilled to see how far it has come since its inception. I want to take this time to say thank you. Thank you to the organization for your mission of educating and bringing together the science and technology community. Thank you to all those companies and individuals that participate regularly as part of Builds Bio Plus. Thank you to my committee members for volunteering your time, and thank you to all the scientists, healthcare workers, and staff that are improving our lives on a daily basis. I would also like to share a special note of thanks to those that educate the next generation, in particular the Stanley Manny Bronx High School of Science. The new state-of-the-art, all-electric laboratory building built to commercial standards raises the bar for high school facilities and provides the students an opportunity to learn not only by the syllabus, but by the building itself. A shining example of a successful public-private partnership, it was a project that I am humbled to have been a part of. By bringing this wonderfully diverse program together today and at all the Builds Bio Plus events, I hope it spurs discussion, which leads to new ideas and creative solutions to the challenges we face every day. Thank you.
Yes, I also want to thank JBB. They have been a great partner and a founding member of this organization. And of course, Mitch has been my compatriot since the very beginning when we first talked about this idea over dinner at the Union League Club in 2017. And here we are today. We're now going to go into some lightning talks on some other new developments that are going to bring us up to speed on a lot of what else is happening in the greater New York life sciences market. The Rutgers Institute for Translational Medicine and Science is fast-tracking new therapeutics and diagnostics to improve healthcare. We have Reynold Panettieri, the Vice Chancellor for Translational Medicine and Science, and a professor of medicine from the Robert Wood Johnson Medical School. We have Carlo Yuvienco, the director of the new Ford Center for Life Science Innovation at Rockefeller University, which is launched in summer of 2023, and the multi-institutional Metropolitan Antiviral Drug Accelerator, which recently received $65 million grant to prevent future pandemics. Dr. David Perlin from the Center for Discovery and Innovation at Hackensack Meridian Health is here to talk about that initiative.
Well, thrilled to be here and want to share with you what is new and hot at Rutgers. That is the New Jersey Alliance for Clinical and Translational Science. This is the only CTSA hub in New Jersey, and it served as a springboard for us to take the wicked problem of clinical trial and clinical research in an academic medical center head and head. So the alliance is between industry, clinical, state, and community. It's based in our institute, the Rutgers Institute for Translational Medicine and Science. Components are 14 cores, span everything from the latest in informatics right on through career development, both graduate students and young faculty. Our first 5 years, which is ending in March, was a $45 million investment. The good news is we've got a highly competitive score, which is going to carry us forward in $65 million for the next 7 years. Now, when we talk about translational science, this is the metric. We go from T0 through T1 and into T4. It takes the components of discovery, brings it into humans, into clinical trials, and ultimately changing policy. Embedded in that is the academic assets for commercialization, which we have now an infrastructure to help entrepreneurs in academic settings actually take their discovery through SBIRs, STTRs, and forward. What we focus, though, on highly in the last 5 years is how do we make academic medical centers the engine for clinical trial recruitment, retention, and participation. Now, I'll give you a clue. In the private sector, to start a clinical trial takes about 8 weeks. Our goal was to do this in 12 weeks. The current metric in academic medical centers is 9 months to up a clinical trial. So what did we vision? How did we reimagine this? We reimagined it through a clinical trials office that does soup to nuts. It improves efficiency, harmonizes, streamlines the logistics, also improves quality simultaneously. And how we did that was to implement a clinical trials management system, soup to nuts. How did one get patients into trials, and how do you follow the patient through the trial for billing and appointments? We then solicited an AI ML solution to scan actually our entire EHR, which encompasses 7.2 million New Jerseyans with 4.4 million that are active. So we can take both structured and unstructured data to find patients who would qualify for clinical trials. Not only that, we could kill studies that we think are going to be futile before we go through all the rigmarole, the logistics to find we haven't recruited a patient. So it's all about efficiency. In our clinical trials office, we have our own counsel who can actually work on the contracts that then OGC, our Office for General Counsel, can sign off on. We have our own navigators that allow people to work through the process. And we have a scientific review board that facilitates our IRB submissions. All of this has yielded now about a 12 to 14 week turnaround for clinical trials across our alliance members. That's RWJBH, our health system, NJIT, Princeton, and of course the Rutgers institutions. So what's the use case? Is it working, Panettieri? Well, we built cohorts in the last 5 years that are quite substantial. We had a healthcare worker cohort. Our notion was that these were first-line first responders that were likely to get infected. We started the cohort actually in the beginning of 2020, and we're able to recruit 5,200 healthcare workers in a matter of 4 months. That yielded about 28,000 biospecimens, which is a rich reservoir for further study. We established community-based approaches because of the diversity and the density of population in New Jersey. We can actually use community-based organizations to assist us in enrolling vulnerable populations. We're about to embark on a New Jersey kids study following 5,000 pregnant women and their children for 10 years to look at chronic illness. These cohorts serve as the foundation not only for research, but for trainees looking to do translational research. We provided the biospecimens for RUCDR, also known as sampled, which acquired the first EUA for the saliva COVID testing, and we were sites for Moderna, Pfizer, J&J vaccine trial. Matter of fact, we were the second highest recruiter for the J&J vaccine trial globally. The third was Columbia, not the university of, the entire country of Columbia. We also participated in the NIH trials, Active 2, in regards to COVID. So I want to thank you for this wonderful opportunity and pass the baton on to my colleague. Thank you.
That's good, Ray. Morning. I'm here to talk to you today about the Ford Center for Life Science Innovation, and specifically the incubator that has been built as part of that 3-floor stack in the Rockefeller University campus. So I want to start my presentation today with sort of a premise, or a preface, I should say, of where we are with respect to biomedical innovation on the Upper East Side of Manhattan, and sort of how this is an untapped field for translational science, as it turns into a startup opportunity. So where we are located, the Rockefeller campus is on the Upper East Side on 66th Street. We straddle 64th and 68th Street and the York Avenue and the East River. So it's a fairly tiny campus compared to most large universities. We're a 16-acre campus if you count the recent 2-acre expansion above the FDR Drive. We're also a small institution in terms of numbers. We're only 2,000 staff, including faculty and research trainees. We're only 72 HOLs or PIs in more common parlance on the campus. But what's sort of understated oftentimes is the wealth of other institutions on the Upper East Side. Now, a lot of people know that as the Tri-I, which includes Memorial Sloan Kettering and Weill Cornell Medicine. But in addition to them, you have a wealth of other institutions that have also had a hand in translational science and startup creation, including the Hospital for Special Surgery, New York Presbyterian as a site for clinical trials, the Tri-I TDI, or Therapeutics Discovery Institute, Cornell Technion, which is across the river on Roosevelt Island, as well as the New York Blood Center, which is located on 67th Street. And so taking that into consideration, those institutions have been there for decades now. There's been this sort of outstanding question of why not on the Upper East Side? And it's been an underserved need to have a place for companies to start and potentially grow in this neighborhood of biomedical innovation in Manhattan. And there are a number of them, but this is certainly one where there is a certain density that is oftentimes the refrain of a lot of people who say, why not New York City? And it's not just sort of the companies, but it's also the talent pool that we have, 2,800 students and postdocs. You're looking at 630 research faculty across these institutions, 1,100 active clinical trials, 73 core facilities, all of which I admit might not be 100% available to startups, but a lot of which would come in handy and are actively used by startups in the New York City community and abroad. And then just among these institutions, you're looking at $650 million in NIH funding in last fiscal year alone. And then I mentioned that there is existing legacy of innovation in the Tri-I, and specifically these companies alone represent a lot of the spin-outs that have come out of the three institutions, Weill Cornell, Memorial Sloan Kettering, and Rock, that have either rooted themselves in other cities in the country or in other neighborhoods in New York City, and having to grow to a particular inflection point of growth to take residency in one of our larger incubators. But what's still an underserved need in this neighborhood is a place for these companies to really just get started with that one scientist or two scientists and a bench offering. So this is the Rockefeller campus itself, so none of the Tri-I, 16 acres. And the incubator that I have been charged to lead is located in one of the late 1950s buildings, the Bronx building shown here. And that's us facing south along that marble path. And what we're looking to stand up here is really a community of high-performing startups that interface between high-impact biomedical research and early-stage commercialization, specifically in this neighborhood of talent. And it's that interface where we feel like magic will happen, where you have cutting-edge research, a lot of which comes out of the Tri-I, and startups in their earliest formations of pre-seed or seed stage capital runway. So what we're looking to offer, and that's potentially distinct from anywhere else that you'll find in the city or the country, for that matter, in this particular neighborhood, is one, there are resources. So these are more commonplace that you'll find in a lot of other places, particularly in sponsored university incubators, which is wet lab, instrumentation, core facilities, and there's also programming for entrepreneurs who are earlier on in their foundational stories. But then there's also the proximity story. So proximity to principal investigators, where during that pre-seed and seed stage company formation period, you do want a lot of high-frequency contact with your scientific and academic founders. You've got the trainee pool, the postdoctoral talent, the clinical trial management talent that's in this neighborhood, and you've also got the hospitals to partner with. And then lastly, another pillar, a third pillar of value proposition that we're looking to really realize in this new incubator is a culture of scholarship and serenity, the fact that this is embedded in the heart of the Rockefeller University. For those of you who are not initiated to the grounds of Rockefeller, I invite you to come for a tour. It's truly like a sort of a mini Central Park on the Upper East Side, and we've got a great esplanade that overlooks the East River that a lot of folks in the neighborhood call the sort of East Side's High Line. And then also a culture, blending that culture of scholarship and serenity with a culture of venture creation, which is really the point of the incubator. Oh, looks like we have a rendering error, but what you're supposed to see here is the floor plan, but what really you want to focus on are the numbers up above. So you've got 8,000 square feet of total square footage on a single floor of the Bronx building, which is 6,700 square feet of usable space. That's high level. It's enough for 10 to 15 companies of 2 to 5 person headcount. We've offered 2 tissue culture suites that'll be shared, 3 instrumentation areas. There are 2 co-working lab spaces and 6 private lab suites that range in size that are enough to, at the max size, fit 6 individuals. And then commensurate with that are appropriate office space and private office spaces. So I'll end my talk here, and it's early days. I was onboarded as the inaugural director in July of this year. We're looking to launch an expressions of interest and applications portal later this month and start selecting tenants in January of next year and having the earliest move-in dates in February of next year. And my contact information is here, and stay tuned for more news as we roll out a website and a splash page.
Thanks. So, good morning, everyone. And it's nice to be here. Thank you for the invitation. And the Center for Discovery and Innovation was created by Hackensack Meridian Health to make innovative science actionable for our patients with cancer, infectious diseases, autoimmune, other acute and chronic diseases. We're located on the former campus of Hoffman & Roche in Nutley, New Jersey, about 7 miles from the Lincoln Tunnel, just past the Giants Stadium in the Meadowlands. The Center for Discovery and Innovation is principally housed in the former Roche Institute for Molecular Biology, which was fully renovated for us. Has expansion space in the new School of Medicine, which is also on that campus, as well as housing the leadership for the Hackensack Meridian Research Institute and new outpatient clinic. Eisai Pharmaceuticals is present there, as well as Quest Diagnostics in their new facility. So it's a real, it's a biotech and commercial and academic hub which has been developed. What I want to talk about today is empowering academic science to be entrepreneurial, empowering academic science to build partnerships, especially regional partnerships in New York and New Jersey and beyond. That's what I want to talk about today. So I'm an infectious disease researcher, do a lot of drug discovery. And when we think about drug discovery, there's always this issue about, well, where are the valleys of death? Well, for a lot of companies and a lot of, especially in the antibiotic space, anti-infective space, for a lot of companies, that valley of death was very in the beginning. So many companies are doing antibiotic and anti-infective, antiviral discovery by acquisition, not necessarily through their own investment. And part of it is that as in the academic world, we just didn't have the resources, opportunity to be able to move things forward. And so that's really what I want to talk about today, is how this has really been overcome in recent years to move all the way through into clinical development. So For academia, there is a lot of money out in the system. There is monies from the NIH, from lots of government investment. That's where us on the academic world comes in. We have commercial ventures. We have lots of commercial partners who we can bring to the table. The idea is bring them together early and effectively with an intended outcome, meaning product development. What does that product look like? How do we bring all these folks together? So bridge these valley of deaths through academic, private partnerships. So two programs I want to highlight, two national programs. The first is, well, one of the problems we've faced in recent years is antibiotic drug resistance. We have high threat bacterial, fungal pathogens. We have viral pathogens, which we essentially can't treat because of drug resistance. So we need certainly new antibiotics. Several years ago, we established one of the national centers. It's a $33 million program funded by the National Institutes of Allergy and Infectious Diseases, which was focused on high threat bacterial pathogens, which you can see here. It included most of what we call the escape pathogens, systemic pathogens, especially for high-risk patients, as well as, for example, mycobacterial true pathogens. Put together leading academic researchers from Rutgers, from our place at Center for Discovery and Innovation at Rockefeller, brought companies together, prokaryotics, Merck, and so forth, and said, let's identify what we're trying to overcome in terms of developing new antibiotics, and let's put everybody together. And let's surround them with pharma-style cores. So no longer as academics do we say, well, we can't do this work because we don't have availability of medicinal chemistry or high throughput screening or modeling or be able to do pharmacology. We'll put all that together. And then we'll be able to function as sort of a not pharmaceutical company, but really drug development enterprise. And so that's what we've been able to do. And I'll come back at the end and show you the fruits of some of these labors. So that's that program. And then more recently, we became one of 9 national programs. This is when National Institutes of Allergy and Infectious Disease announced the antiviral drug accelerators. There were 9 awarded, of which we were one. This is a partnership then, and I lead this program with Charlie Rice, the Nobel laureate at Rockefeller. It's a $108 million program that was approved, and it's to develop next generation antivirals that can be used for the outpatient clinic. So we're already establishing what the product profile needs to look like. And it's going to be against SARS, other coronaviruses, and viruses of pandemic concern. Initially, the program, which is a partnership, involved a core group with us and Rockefeller. It had Columbia University, it had Rutgers, Memorial Sloan Kettering, and had Alagos Pharmaceuticals, which is a West Coast firm, but essentially local. It's now been expanded to include Yale, Princeton, has University of Arizona, UCSD, and most importantly, it has commercial partnerships with Merck. It has the Tri-TDI, which you just recently heard about, which also has Takeda as one of its supporter. So we wanted to mix academic science with commercial sector to be able to develop products. Here are some of the folks who are involved in the Metropolitan Antiviral Drug Accelerator with Julian Simons at Alagos, myself working closely with Merck, Tom Tuchel's working with the Tri-TDI and Takeda, and then other members of the consortium. Leading academic groups, leading scientists who have very strong world-class antiviral programs, partnering them with industry to be able to move work forward. And the key, again, is what I mentioned earlier, which is this series of cores, pharma-style cores, to be able to allow us to go from discovery through lead development, through lead optimization, through preclinical development, so that we can now efficiently move and develop products in this space. And as I alluded to, the product of all this is that for the antibiotic development in the last 5 years, we have very successful programs that have developed now molecules, optimized lead molecules, which are now entering into IND enabling and preclinical development. That's on the antibacterial side. We have then on the antiviral side at least one drug that will be going into clinical trials this year. This is all within now less than about 15 months of activity. So the program really is about accelerating development. And we have a lot of the tools, a lot of resources, but the key is partnerships, regional partnerships, taking advantage of the assets that we have in this region, in academia, in the commercial sector, putting them together, identifying that product profile, and then agreeing together that we're going to develop it early so that when we then get to the clinical stage, that molecule has a good chance of being successful. And so that's our basic model. We use it for infectious diseases. We use it in the oncology space, and then beyond. So I'll stop and take questions. Thank you.
Are these mostly small molecules, these antivirals and antibacterials, or a mix?
So for both both programs, these are small molecules that we've been developing. On the oncology side, it's principally immunotherapies. Antibodies are cell-based therapies.
Quick question. The merging for expediting purposes of academia and commercial side, don't you run into issues, or how are you going to deal with like the proprietary nature of some of these discoveries and how that relates to patents and proprietary use by various pharmaceutical companies? How do you work through that?
So the key for developing these consortia is the basic concept that each of the institutions, both the academic institutions and commercial groups, buy into, is that for each project lead, whether it's coming from an academic center or it's coming from a company, all the intellectual property stays within that project. It never crosses over. The cores then are agnostic to it. They provide data, but they never cross between projects. So data that's generated for one project stays in that project, and all the intellectual property belongs to that project lead. And that's the buy-in that was required for groups to be as part of the program, and it's actually worked quite well.
That's great, but once it gets out of that environment, ultimately it may end up in a commercial pharmaceutical or what have you. How does it transfer, so after clinical trial, into a product for a consumer, et cetera?
Well, for example, on the antiviral side, 3 of the programs already have commercial partners, whether it's Merck, Allergos. So they're already committed to the commercial development. So that was key. For the ones that don't yet have commercial partnerships, then there's opportunities to present that work, and either some of the in-house companies who we work with, whether it's Merck, could be Pfizer, or others, who have an opportunity to look at it and then develop commercial relationships to be able to take it forward. The key here is we have to be able to move these programs into the clinic. I mean, if they don't wind up in the clinic, then we're not really doing our job. So we have to create a pathway for that commercialization through partnerships. And there's other ways to do it. We can do some of it with BARDA, spinning out companies, but fundamentally it's commercial partnerships that at least initially are going to get it there.
Thank you.
I just wanted to know how Rockefeller was going to get the word out about applications and tenants.
Yeah. So in terms of our marketing strategies, so it's we're going to be launching a website later this month with that application material and process in place, and as well as our pricing. And then in terms of further marketing efforts, a lot of which will be reliant on program partners. So partnering with a lot of the academic programs that support entrepreneurs, especially in the area. And we're going to start off sort of with a modest effort of outreach. With the idea of, even though we're working to serve anyone who wants to take space in our incubator, there is also this notion that we want to also give some type of special consideration to the immediate vicinity that's arguably been underserved with respect to this product. So working with a lot of the PIs in the neighborhood and seeing what they might have up their sleeve in terms of startups and opportunities, working with the technology transfer offices in the neighborhood, and then concentrically out from there, working with our relationships among the other academic medical centers in the city. But most immediately in this first year, it will be starting up modest efforts. And just to underscore that a little bit, this is fairly new for Rockefeller. The institution chose to go in at this alone with full philanthropic support from its current chairman of its board of trustees. We don't have a third-party operator operating the space. So I and my staff are going to be Rockefeller University employees as well. So there's going to be some lessons learned, I would imagine, in the first months and if not years of operation, but it will be highly bespoke to the community that we're serving, is the upside. If there are no other questions, David, I've got a question for you,
Sure.
actually. So to the builders in the audience, and given sort of the real estate origins of this conference, this symposium, I couldn't help but notice that you have BSL-3 on your slides.
Right.
Did you rely on existing BSL-3 facilities, or did you guys have to build with the grant?
So we had existing biosafety level 3 facilities that we put in place when we were establishing our research institute. There was one small laboratory there, but we built additional space. And in my previous previous position, actually while I was at Rutgers, I ran the Rutgers Regional Biocontainment Lab, which was one of the national centers. So we've had a lot of experience in running those facilities. We're now in the process of building out additional biosafety level 3 space, which will be specialized actually for development of countermeasures to high threat pathogens, mostly viruses.
Okay.
Yeah.
Wow. Something to keep in mind for the audience. Yep.
And then follow up, in New Brunswick, it was mentioned the Helix building is going up. Anticipated finishing of that will be the end of 25. That's 1.4 million square feet, right in the center of New Brunswick, which will also house the new medical school, along with about 50,000 square feet of incubator space. Very exciting. And even more exciting is that Amtrak is now going to stop in New Brunswick. That's key, right? We're going to have 13 stops now, right in New Brunswick, right at the Helix building, attached to the New Brunswick train station. So, it's an exciting time for the tri-state area in incubators and startups, and we're certainly encouraging anyone to focus on New Brunswick.
Nancy.
Dr. Panettieri, I was just wondering, in your program, with the cohorts that you've developed, how have you addressed the need for diversity in clinical trials? Increase diversity.
That's a great question. And just to reiterate that, how did you build and embed DEI and A access in your cohorts? Well, we didn't have to go far. The good news is New Jersey is one of the most diverse and densely populated states. And so we embraced that in and around COVID. We really reached out to communities in a bi-directional way to meet their research desires and needs and that of the investigators, matching them. And the trick was really to embrace community-based organizations. So our network is 210 CBOs, community-based organizations, that we actually engage them in the recruitment of subjects with a return on investment that they will know about the research before anything gets published. They'll understand the value proposition of research, and that takes a lot of trust, right? The trust is hard to build in clinical research. We're still suffering from the lack of trust in research in communities. So we're trying to overcome that, and we've been helpful, mostly because New Jersey is an urban state. That means that everyone in the state lives 20 miles from a city. That's an urbanized state, and there's only 3 of them in the United States. That gives us greater challenges and also greater opportunity.
So did you have an educational outreach built into your program?
Yes, absolutely. So one of our cores, headed up by Shauna Hudson, is a community engagement corps. It has some of the largest money dedicated to engaging the community-based organizations, having them and having town halls, understanding what was important to them, and then bringing and matching them to the principal investigators so they would understand what we would have, what we could offer the community. Very, very important. The other thing we've embraced, which is really exciting, is a micro badge or micro credentialing program for citizen scientists. Our first 52 community individuals have completed a badge or a micro credential in community-based scientists. And they now serve as our ambassadors, understanding the intricacies of some of the scientific method, and they're really helping us engage the communities.
Thank you. Okay, well, thank you very much.
Thank you.